Welcome to My Doctor Show this Wednesday, where we promised you that every Wednesday on My Doctor in a couple of months we will be bringing you issues related to pregnancy. My name is Purity Museo. Now today we want to talk about something that should never be controversial, but it has unfortunately been incredibly controversial. We are talking about birth control or use of contraceptives. Now, according to the Global Health Report, between 1994 up to date, the number of people using birth control methods has increased by 8.3%. But something important to note is that in Africa, that's not the case. The numbers are still very low. The reasons being accessibility to birth control methods as well as the cost that comes with that. But the most important thing to note is that there has been a really opposition to use of birth control methods, and as well as people have no knowledge about which even methods are suitable for them. And it's also important to note that as someone who is sexually active, then it's important to be able to determine when and how to have a baby. Therefore, preventing yourself from getting pregnant is something really important. And our topic of discussion today is birth control. Talk to us. You're always welcome to be part of our show by maybe asking a few questions or sharing with us what you feel about birth control methods, and if you're using any, which one you are using. In studio, we'll be having a very special expert. He's a gynecologist. His name is Dr. Alfred Murage, and he will be breaking down for us which ones do we ought to use. My name once again is Purity Museo. But before we start, I will just request you to sit back, relax, and wait for this exciting show ahead. Let's first have a look at what's coming up.
Now, contraceptives are methods or techniques that a woman may use to either space or limit the number of children. And this now does not only include women, but also includes couples, because it's a topic for couples, yes. Indeed, there are different types of contraceptives. You may want to look at them from the standpoint of what is for the man, what is for the woman. You may also look at them from the duration of action, and also you may want to look at them from whether they are hormonal or non-hormonal. So for example, if we look at the methods that are available to men, for example, we have condoms. So this is one of the most widely available methods. The second method available to men, which they don't like to talk about a lot, is vasectomy. So vasectomy is also a method that is available for men. Now, what our sisters or the mothers or our daughters can use, on the other hand, they are varied. There are quite a number of them. And here we start with, for example, natural methods. A lot of controversy exists and a lot of questions about how you can use that. So that's a whole topic on its own. Then there are other methods, what we call modern methods. Under modern methods, we have those that are hormonal and those that are non-hormonal. So hormonal methods include, for example, you can have the pills, the everyday pills. We can have patches. We can have injectables. There are implants that can be placed under the skin, and there are also coils that have hormones. The non-hormonal methods include things like female condoms. There are cervical caps and diaphragms, but there are also non-hormonal coils. So that's generally how you can class the methods. Okay, we class the methods generally into three. So for example, they are the least or the lowest effectiveness. Then you have the middle or the average or the moderate effectiveness, and also the highly effective methods. So for example, things that do with natural methods. Natural methods generally are considered low effectiveness. These include things like withdrawal, rhythm methods, but they are also very user dependent. Okay? Then we have the middle level methods. These include things like condoms, for example. Then there is the highly effective methods. These include things like coils, implants, injections. So pills also come under the middle level methods. So that's generally an overview of how effectiveness is classed. Let me tell you, any method that is introduced to the market, like all pharmaceutical products, goes through a very rigorous testing period. And many of actually all the contraceptive methods have not been conclusively, and I'm using the word conclusively, proven to have an effect on the risk of cancer. A lot of that data is what we call confounded, or it's made, it gets confusing because of other issues. For example, if you say, for example, using pills may increase the risk of cervical cancer, but it may also be that the people who use pills are also having an unprotected sex, and therefore HPV, which is the virus that causes cervical cancer, is likely to be more prevalent in them. So some of those myths are not based on real scientific fact. In fact, some methods actually reduce your risk of getting cancers. For example, if you have a tubal ligation, it actually reduces your risk of getting ovarian cancer. Yes.
My name is Purity Museo. Today we are talking about birth control, and what you've just watched are some of the highlights from Dr. Mukaindo Mwaniki of Aga Khan on some of the methods or options available. You're welcome to be part of this discussion today. The SMS line is free of charge at 20268. The number to use to call in directly will be displayed on your screen, or you can talk to us through our Twitter handle at Ebru TV Kenya, the hashtag #MyDoctor. In studio joining me is Dr. Alfred Murage. Welcome to this show.
Thank you,
and thank
Purity.
you so much once again for making time for us.
Yeah.
Today we are talking about something that should never be controversial, but it's really controversial: birth control. What is birth control to begin with?
Yeah, I think the way to look at it is just to say simply, birth control is preventing pregnancy.
Okay.
And by that we mean preventing pregnancy occurring unexpectedly,
Okay.
or preventing it from occurring when it's not been planned. And, you know, birth control is the same meaning as contraception,
Okay.
same meaning as, you know, whatever other people could use to mean that they are trying to prevent a pregnancy.
Okay, and
Yeah.
you're talking about preventing pregnancy. Does it apply only, does it mean that it can only apply for women, or men can also as well use some methods to prevent pregnancy? They don't get pregnant?
Yeah, no, you're very right. You know, we don't want there to be any confusion.
Right.
There's a role for men to play to prevent birth control, to prevent pregnancy, and for women as well. Unfortunately, most of the birth control methods are geared towards women, but there are methods which are geared towards men. And I think there's new research coming up where there might be more methods that men can use to prevent pregnancy.
Yeah, and before we get to the methods, how known are these methods of, or how known is birth control, especially in Africa?
Yeah, you know, it's recognized in, you know, out there in the scientific world that there is more availability of birth control in the Western countries than in developing countries. In fact, WHO estimates that there's about 200 million women who don't have ready access to birth control.
Right.
I think this is because of a mixture of many things, both information, availabilities, economics, and all those things. But I think in this day and age, you know, it's up to us to make sure that, you know, people know that these birth control methods, and that, you know, part of, you know, what you're doing today, you know, is passing on that information.
Right.
And everybody should be aware that there's something out there that they could use to prevent
Right.
any unwanted pregnancies.
Okay, and before we get to the resistance, because the same WHO or the health reporters really highlighted a lot of, or so much resistance for use of birth control methods, especially for Africa. But before then, what are some of the challenges facing accessibility for these birth control methods?
I think part of them would be, like you just said, people may not be aware what is available, and they may not also know that there are so many methods which are out there that virtually can suit anybody regardless of their health status, their circumstances. Number two, there's some methods which may be out of reach in terms of cost.
Right.
But like in Kenya, for example, there's a government subsidy on birth control methods. So people shouldn't feel really, you know, unable to use any methods because of cost, because there would be a subsidy in terms of, you know, cost for public health. And then the other things would be, you know, there might be erroneous beliefs, either cultural beliefs or sometimes religious or even political, which sometimes, can make people wary of, using birth control methods. And these are, like you said before, these are myths that shouldn't be out there, and people should know that, birth control is safe and is something that has a lot of benefits, both in terms of health, economics, and many other things.
Right.
Yeah.
And Doc, you've talked about myths and stereotypes. Maybe what are some of the stereotypes that are linked to use of birth control methods which are not true? Because one of our viewers is asking whether pills cause infertility. Those are some of the fears among people. Maybe what are some of the stereotypes for birth control that are not true?
Yeah, well, let's answer that. The answer is certainly no. None of the birth control methods will cause infertility. Okay. What they are doing is they are trying to prevent pregnancy at a certain period of time, and when pregnancy is desired, then the birth control method is stopped, and then the pregnancy is going to happen. Or like, Dr. Mukaido just said in the opening statements, there's some erroneous beliefs about association with diseases like cancer. And if you look at, the scientific data, there's a lot of conflict about that, kind of data. And there's overwhelming evidence that there's more benefits than risks with birth control. And, this is even linked to benefits, for example, maternal deaths during pregnancy.
Okay.
And, women who use birth control to space their pregnancies, to get pregnant when they're at their healthiest point, have less risks in pregnancy, and is, linkage with lowered mortality rates during pregnancy.
Okay.
So overall, the benefits far outweigh risks, and if anybody's out there, they think there's something not quite right with birth control, the best thing usually would be to seek out help with a healthcare provider, have a bit of a discussion, what is it that, they're not sure about, what's their fears about birth control, and that would normally get addressed, and then all their questions should be answered. And then they might find something that is suitable for them and agreeable.
Okay.
Yeah.
Our topic of discussion today is birth control or use of contraceptives. Talk to us. The SMS line is 20268. And the call line is displayed right on your screen. In studio, we have Dr. Alfred Murage, who is taking us through some of the birth control methods. I can see some of your questions and comments coming in very quickly, but we will be responding to them. Doc, let's continue. Why is it important for someone who is sexually active to consider using some of these birth control methods?
First and foremost, nobody should really get an unwanted pregnancy.
Okay.
And, that's very important, especially for, our adolescents. Number two, certain birth control methods would additionally prevent against sexual infections. And we're talking about barrier methods here, like condoms, which is, a big factor, especially for people with multiple sexual partners. Number three, there's a lot of benefits to be gained with child spacing. And the ideal spacing depends on couples and their individual circumstances. However, the WHO defines about 2 years as an ideal spacing from one child to the next. And that spacing allows the women to recover from, the previous pregnancy, get back into good health, and also be able to plan economically for the next child. So both preventing what is unwanted, which may lead sometimes to unsafe abortions, and spacing pregnancies then would have very many benefits. Yeah.
And you're talking about importance, why it's important for everyone who needs to, maybe if you're not ready to get a child, to consider some of these birth control. I understand we have birth control for women and for men. We can start with men, or I'll be biased.
All right. No, you're not biased.
We start with men or women?
Whichever you want.
Let's start with women.
All right.
All right. Okay. What are some of the birth control options for women?
They're quite a varied choice, and they vary from, what is said to be long-acting methods, which are very effective. These are methods that can be used for years. A few examples would be like what is called an intrauterine device. It is called as copper coil commonly. And if this is put in the uterus, the newer ones would last up to 12 years.
Permanent and a permanent methods?
No, this is not permanent. This is reversible.
So we have permanent and temporary, or reversible?
Yeah. So I'm talking about what you can call them long-term methods, which are reversible. And, like I was saying, the coil can last for up to 12 years, the modern coils. And whenever women want to get pregnant, they just need to be removed.
Okay.
There's what is called an implant that is put under the skin on the arm, and lasts about 3 to 5 years.
Okay.
Again, when that is put in.
Maybe, Doc, you can take us step by step. Now we are at the long-lasting methods.
Yes.
You've talked about the coil, which can last to up to 12 years.
Yes.
Maybe how does it? Maybe if I need one, how do I go about it? Who do I need to approach, and what is the process like to having the coil?
Okay, simple. Once, let's put it this way.
Okay.
When a woman desires contraception, then the best thing is to go to a nearby family planning clinic. It could be a public facility, private facility, or any doctor's office, and then they would have a discussion about what kind of contraceptive they desire. And then if they choose the coil, one of the things that would be checked is that it can be safely put in the uterus. And then there'll be a discussion about, what to look out for when it's been put in, and how long they want it to last before the next pregnancy.
Okay.
So, for example, if somebody comes in, they're looking for something short term, for example, less than a year, then the coil may not be what they desire, because it's going to last for 5 years, 12 years.
Okay.
But if they're looking for something really long term, then after that discussion, then the coil usually would be placed inside the uterus by a very simple procedure, and best done after a period has come and just finished, to make sure that when it's being put in, there's no chance that there could be a pregnancy. Yeah.
And I have an interest in this. Maybe, Doc, for women, we can categorize them, the methods that we have, put them into categories and go through one by one, and we see from your perspective as a doctor, which one is more, which one do you advise, especially for women who want a long-term one, not a long-term one?
Okay,
yeah.
Fine. So let's finish with the long-term ones.
Right.
So we talked about the coil. The other one is what we call an implant put under the skin. Again, that's for years, 3 to 5 years. Then beyond that, then there would be, the pills, which are usually taken every day, every day for 21 days. And then there's a break to have a period, then start again. There is what is called patches that can be put somewhere on the skin. And these are very convenient. They are put once every 7 days, and will give protection for the whole, duration. And, for people who cannot really swallow a pill every day, then a patch may be more convenient, because they only need to remember once a week to change and put a new one. Then beyond that, there will be injectables. And the common one is called Depo, which is injected once every 3 months. Yeah.
So let's go through. You've talked about coil, you talked about implant, you've talked about injectable, you've talked about pills. Is there another one? There are 5. There are 4 or 5 for the long term?
You can call the pills sort of medium to short term, because they are user dependent, and as soon as women want to discontinue them, then they can do that. Beyond that, then, and maybe we'll talk about that much later on, there's, what is called permanent contraception for women, which is usually, tying the tubes. And that, for people who have completed their family size, they're very sure they don't want another pregnancy ever. Or in very rare cases, maybe they have some chronic illnesses that, would make pregnancy very dangerous for them. And then that would normally be recommended.
So let's go through these 4 types that you've talked about, the long-term ones, beginning with the coils, what it is and what are some of the advantages and disadvantages, and do you recommend it as a doctor?
Yeah, what we do, as doctors, we want the ladies to know all these choices.
Right.
And then discuss with them what appears to appeal to them, and, answer the questions that they may have in terms of, would this suit me? Will this not suit me? And then come to a compromise. Because what we don't want is to, enforce one method over the other. But I think the key decision is usually, how much long do they want to use the method for? And if they want long term, then it makes sense to go for something which is longer term. If it's on the short term, then they can choose something that they can use and stop whenever they want. Because, for example, the coil, it needs to be put in by a healthcare provider it needs to be removed by one. So that obviously has a bit of commitment coming to get it fitted in and coming to get it removed.
But it's still okay for someone to go for the coil?
Oh yeah, certainly, yeah.
Is it cost effective?
Oh yeah, because if it's going to last for 5 years, then, as soon as it's been put in, you never ever need to think about, contraception.
Okay.
You never need to think about, whether you could get pregnant by accident.
Okay.
You don't need to remember to do anything. Yeah, so it's put in, and that's it.
Are there complications that come with that insertion of that coil?
Well, rarely, yes. Sometimes it may not go in easily, and women might feel a bit uncomfortable when it's being put into the uterus. In very rare cases, it could go to the wrong part of the body, like go all the way through the uterine wall and get into the abdomen. Very rare occurrences, so I wouldn't want anybody to be feeling uncomfortable about it. And then beyond that, then some women complain of a bit of a discharge when they have the coil. It's important to mention that it's not an infection.
Right.
It's because, the threads are kept, visible on the neck of the uterus, the cervix, to ease removal when that time comes. So sometimes that causes a bit of a discharge, but it's not really an infection.
All right. Is it at the beginning, or that's the kind of life that you lead? Sometimes regularly you can have the discharge, or once it's inserted, then life goes on?
It's sort of variable.
Okay.
Some women will not notice anything different, but some will report some increased secretions. Okay. And then, there's a bit of association with heavier periods in some women as well. So it's not unusual to hear, a lady come in and say, before the coil, my periods were lighter, and I'm noticing that they're slightly heavier. Okay. Sometimes that can happen. But these are very variable occurrences, and they will vary from one individual to the next. And if things became troublesome, then it can always be removed and something else chosen. Yeah.
And what group of people, what category of women do you maybe advise to consider this method?
Yeah. I think generally speaking, anybody who wants to avoid hormones, because the copper coil doesn't have any female hormones, so if it's important for somebody to want to avoid any hormones, then that's something that they could choose. And as we said, if they want something long-term, before I forget, I need to say there's also another coil which has a hormone. It's called Mirena. It was actually developed for people with heavy periods, but it's also contraceptive. But it's good that people know that there's a difference. There's the copper one and the Mirena one. The Mirena one lasts about 5 years.
That's all about the coil. We can get to the implants.
I'm sure somebody will have a question about what we haven't mentioned. Yeah, and then if something comes up, then we can address it.
That's right. Let's get to the implant.
Okay. Now the implant is usually 2 rods that are inserted under the arm. When this came about years ago, there were many rods, about 7, but now they are less. And then the rod is put just under the arm on the non-dominant arm, usually the left arm, is on the side of the body where it's not really visible, and it's very easily put in. And once it's put in, then it produces a hormone that will stop the women from releasing an egg every month, and prevents pregnancy. And again, it's long term, so it will stay there until either it expires or the woman changes her mind and wants it removed.
Okay. Yeah. And Doc, you've talked about implant, and maybe between the two, the coil and the implant, which one is easier for someone to choose or to go with, or which one is your best as a doctor?
Well, now, I'm trying my best here to avoid, saying best or, not, one better than the other.
But you feel it's still okay?
Oh yeah, it is, because, some people will feel they don't want something put in the uterus for whatever reason, or they had a previous experience, like we said, with maybe an unusual discharge, which, they were not too happy about, and they still want something long-term. Then they could use the implant as an alternative. And, so it will vary from one individual to the other. In terms of pregnancy prevention, they're more or less equivalent. They're very effective over the long haul. And therefore, would expect that, there will hardly be any pregnancies with the implant or with the coil. So I wouldn't say one is best. I would say let women look at, one against the other, and see for themselves, what would I select here.
Okay, and maybe does it have any side effects to a woman? Because you said it's on the arm?
Yeah, you know, when you're inserting something under the skin, there would obviously be a little bit of discomfort.
Okay.
And what we'll do is we'll put something that nubs the skin there, and it's very easy to put it in. And then after that, there should be nothing to feel. You don't see it. There's hardly any scar that forms. And then over time, some women may notice a bit of spotting in between. You know, that sometimes may make some people feel uncomfortable, and the periods may be lighter, which is not a problem.
Okay.
And then when it expires or the woman desires to get pregnant, then they would come back for it to be removed.
Right.
Yeah.
So many interesting questions coming in.
Okay.
But we want to take a very quick break. When we come back, we can continue with the injection and the peel, right? All right, let's have that break. When we come back, we'll also be looking at your feedback. Talk to us. The SMS line is 20268. The call line is 0791478990. It's 0791478990. Just do stay with us. We are back shortly. Welcome back. You're watching My Doctor Show, and in case you're joining us for the very first time, my name is Purity Museo, and today we are talking about birth control or use of contraceptives. Remember, this is the time that we will be receiving your calls as well as looking at your feedback. I can see them coming in very fast. The SMS line to use is 20268, and the call line is displayed right on your screen. Welcome back, Doc, to this second part of the show.
Okay, thank you.
Yeah, so many questions coming in regard to injection and the peel, and that's what actually we want to talk about. We've already discussed about the coil and the implant. So now can we get to the injections?
Okay, yeah. The injection is, you know, the commonest one is called Depo, Provera, and it's given once every 3 months.
Okay.
And it's quite effective in preventing pregnancy. And but the women need to remember to go, you know, to get it updated every 3 months. And, you know, the few things to mention about it is it can make the periods go away. And that's usually not a problem so long as we know that the reason the periods are not coming is because of the injection. And, you know, if it's used for a long period of time, usually over 2 years, there can be a slight delay in return of, you know, potential to conceive.
Okay.
So we say when the Depo is stopped and periods don't resume, there should not be any panic. They should know that it's because they've used it for a longer period of time.
Right.
And periods are going to resume.
Right.
They're going to start.
Wait a bit, Doc.
Okay.
You want to tell me the injections, they interfere with someone's periods?
Yes.
You don't get periods once you get the injection?
Not every woman. For some women, the way the Depo works, it can, you know, make the ovaries, we call it suppression, you know, there's hardly any hormones that get produced to allow a period to occur every month.
Okay.
So if anybody's using Depo and they're not getting periods, they should not panic. And it's because of the Depo.
Okay.
And once they discontinue, the periods will resume.
Okay.
Yeah,
I think Sharon wants to ask in regard to the injection, because you've talked about the periods and the delay and all that. Let's hear what she has to say.
Okay.
Hello, Sharon? Sharon? Okay, we've lost her. But before we continue, we just want to have a look. We have a very special segment, Home Remedies. We just want to have a look at what we've prepared for you today. Take a look. And welcome back. You're still watching My Doctor Show, and the topic of our discussion today is birth control. Talk to us. The SMS line is 20268, and the call line is 0791478990. Doc, before we went for that, or before we continue, there's someone who wants to talk to us.
Okay.
Hello.
Hello?
Hello, Helen. Hi, how are you?
I'm fine.
Yeah, please talk to us.
Yeah, I wanted to ask the doctor the difference between the Depo injection and the semi-plan injection.
Yes, Ellen?
And how does it work?
You've heard her?
Yeah, yeah.
Okay, thank you, Helen. Thank you. We're going to
The
respond to
second
you.
question is that,
Okay.
hello?
I can hear you. Yes?
I wanted to know,
Yeah?
when you are in this family planning, there's this issue
Mm-hmm.
when the family planning gets about the, hello?
Yes, I can hear you. Just reduce the volume of your set.
Okay, I've reduced.
Yeah?
Okay, there is this, the implant.
All right.
Most of the women, when they insert the implant,
Mm-hmm.
it brings about the asthma thing. The chest becomes congested most of the time.
Okay.
So I wanted to know if these things are for real or they can only test 99% and they just have a lot of side effects.
Right. We've heard you, Helen. The doubt on the use of these methods.
Okay,
Are
yeah.
they, she's asking, are they for real or they're
Well,
just 99% effective?
No, the effectiveness is proven.
Okay.
So the methods that we say are user dependent, for example, taking a pill, so long as a pill is taken judiciously, then pregnancy, practically will not happen. And, the injection, and the longer term methods which are going to work anyway, then, they are also very effective. Now, to answer the question about she asked about Femi plan,
Right.
which is, we're going to talk about the pills.
Right.
Is is one of the pills, and the injection. Femi plan is, we call them combined pills. It has two of the female hormones,
Okay.
called estrogens and progesterones, while the depot has only one of the hormones called progesterones.
Okay.
So that's the main difference. And the pill obviously has to be taken by mouth once a day, and the injection is, what we said, once every 3 months.
Okay.
The question about, the implant and, chest congestion, there's really no connection, and is likely it's coincidental. People might have, chest congested for whatever reason, and then sometimes associated with what they have done. So there's no real connection there.
Okay.
And, it will not cause that, and
Okay.
it's not linked to things like asthma, for example, like she was saying.
All right.
Yeah.
And Doc, very quickly, because we do not want not to talk about men, we don't want to be biased, maybe we can finish up on the pills. You've talked, okay, we're still on the long-term methods. The pill you talked about, you take them 21 days consecutively,
Yeah.
then what happens after that?
Now, the way the pills are designed is to mimic, what happens during a menstrual cycle.
Okay.
So, taken every day, the pills then will get to prevent the ovaries from producing their own hormones and releasing an egg. So the lining of the uterus is, completely suppressed during that period of time, and because there's a sustained level of the hormones, when the pill is stopped on the 21st day during that pill-free week,
Okay.
but some pills have what is called DAME tablets, which don't have the hormones. They might contain some vitamins
Okay.
or even iron. Then during that week, then the lining of the uterus is shed away,
Okay.
and there's bleeding. And then as soon as bleeding comes, then the next pack should be started. So it's 21 days of active tablets. But there's various configurations of the way the hormones work and the content and all that. But the basic thing is, active days of the hormones, and then towards the end of the month, which is 21 to 28 days, then there's either no hormones or very low doses.
Okay.
Yeah.
Then maybe, Doc, we can now look at the short-term methods, and then quickly permanent, before we could have a look at some of the feedback here. And also, we don't want to forget men,
Yeah. You could consider pills like, short term, because some people want, maybe 3 months, then they stop. So you could consider that as short term, or even the injectables, because you can use for, let's say, half a year, then stop. So you can say those are short term. The other things would be things like barrier methods, these, female condoms as well, which, can be considered also like short term methods. And, there would also be devices that can be placed on the neck of the uterus, the cervix, which again form a barrier. And, again, you can call them, sort of short term to medium term.
Right.
Yeah, yeah.
And Doc, let's talk about the P2 pill. It's really widely used. It's available all over the chemistries and all that. How do you explain about it? How do you say about it? Is it still recommended by doctors, the P2 pill?
Yeah, the idea of the P2, you know, which is emergency contraceptive,
right,
is to prevent, you know, an unwanted pregnancy, which may have happened because there was sexual exposure, which was unexpected.
Okay.
You know, for people who are not on long-term contraception. So.
And Doc, can you hold that thought? There's someone who is calling on the P2, but we are talking about that shortly. Lucy from Dagoretti. Hello, Lucy.
Yes.
Yes. Hi. How are you?
I'm fine.
Yeah, we okay too. Your question, please.
Yes.
Lucy, just reduce the volume of your TV so that I can get you clearly.
Okay.
Okay, go ahead.
I'm asking, can you get pregnant when using a coil?
Okay.
Yeah.
That's it. Simple. She's asking about the coil.
Yeah. Well, the practical answer is no. You know, the coil is going to prevent pregnancy. However, all these methods have a very tiny, what we call failure rate. So if somebody is on the coil and they suddenly miss a period,
right,
they must do a pregnancy test. And then if it's negative, then the matter is over. It's just a delayed period. If it was positive, you know, that would be one of the rare cases when, you know, people can still conceive when using, you know, an effective method. Then she should immediately, you know, get to see her gynecologist.
Okay.
Yeah.
But it's still okay. There's no negative effect on her body because you have the coil on your uterus and at the same time you're pregnant. Is it going to interfere with your pregnancy?
Usually not. If somebody conceives with the coil, what we do is they come in, we do an assessment and just remove the coil, usually. And if it wasn't easy to remove it, then we just leave it and pregnancy carries on.
Okay.
Yeah.
And quickly we'll be moving to men. But before then, we have many questions here, but let's just have a look at a few of them. I haven't had my period since I gave birth. That's 7 months ago, and I used the pill. So my question is, will it affect my period ever coming back, or will it, or which is the best method? She's asking about the pill. She had her birth and then she's taking the pills and it's affecting her periods. But before you answer that, let's receive this one call.
Okay.
Okay. Hello.
Hello.
Hello. Hi.
Hi, how are you?
We are good. What's your name and where are you calling us from?
My name is Grace. I'm calling from Langata.
All right, go ahead.
Yes, I was asking.
Go ahead.
Okay, I was asking about the depot. I got the last shot of depot on September.
Okay.
Then now I'm trying to conceive. There's nothing coming. It's now 6 months. I'm worried. Could the doctor please tell us if there are any disadvantages or does it cause delays and for how long?
Okay, thank you so much.
Because I'm a bit worried.
All right, thank you so much. You talked about that, but you can respond to what she's asking. She's a bit worried.
Yeah, she, I think if I got it correct, she had the last one in September.
Right.
And her periods have not resumed. So what I would say is, depending on how old she is, you know, it may be any time now the periods will come back. However, if for older women, for example, in the 40s, then it sometimes could take longer because of their changing ovarian function. So I would say to young people, if periods have not resumed, you know, after 6 months, they can get, you know, get that checked out. And usually there's not much to do. Would normally, you know, reassure them that the periods would still come back at some point. Yeah,
okay.
Yeah.
And I think it's the same question we had here on the pill. I took the pill, but the periods are not coming back yet.
Yeah,
I think they are both answered.
Yeah.
Let's hear what Damaris. Hi, I'm Damaris. Nataka nisaidiwe. Nilitumia sindano ya mwezi 3 mara 2 kabla ya kupata mtoto 2016. Kutoka hapo sijaitumia tena, lakini periods zangu zilikuwa za kuja kawaida. Nikaoleka 2016 December na sijapata mtoto. The same problem, right? On the injection and then the periods have not resumed.
Yeah, yeah. So usually, you know, the longer it takes for periods to come back, the more we want to check that there's nothing else to explain it. So I would say, you know, especially for very young women, after stopping the depot, if periods are not back within, you know, 3 months, there shouldn't be much reason to worry. But when you get towards the 6th month, then it makes, a bit of, it's reasonable to get checked out to see that there's nothing else to explain the failure for the periods to resume.
Okay.
For the majority, there'll be nothing else really, and the periods, tend to come back.
And actually, it's all about the injection. It has really this effect of delay of period.
Yeah,
maybe,
yes.
Yes,
Yeah,
and someone may be asking, can it cause infertility?
But it doesn't cause infertility. And that, should be very clear to everybody.
Right.
What can happen is, for example, if somebody has stopped, 3 months backwards, then the periods have not resumed and they wanted to get pregnant within that interval.
Okay.
Then there's a bit of a delay for them. But in terms of has it caused them to become infertile? No.
Okay.
Yeah.
Someone else is asking, I'm experiencing heavy periods which goes for 2 to 3 weeks and a severe headache. Is it one of the side effects for implant? Maybe she had an implant and this is what she's going through.
Yeah. The implants can be associated with a bit of irregular bleeding. It tends to be lighter rather than heavy, and sometimes it's just usually spotting. So if the period appears to be heavy, then she should get seen by her gynecologist. Headaches usually not a common combination, but sometimes people can get unusual symptoms which may or may not be sometimes associated with what they're using. So when she goes to get checked for the heavier bleeding, then she can get that cross-checked as well.
There's treatment for that, for the heavy bleeding?
Oh yeah. What we do is if there's unusual bleeding with the implants, then once we exclude other causes for that bleeding, then sometimes we would give them just a common pill by mouth, and it tends to regularize how much they bleed from then on. And people who are very troubled by unusual and annoying bleeding, then sometimes the way out is to change their contraceptive to another method.
All right, and just another one. I'm Lensa watching from Gatundu. Is it true that coil cannot be used after the first birth?
That's not true.
Okay.
A coil can be used, anytime. It can be used shortly after delivery or, after a miscarriage, and can even be used by adolescents.
Okay.
Yeah.
And have heard from friends that the coil or implant can cause weight gain. Is it true?
Well, the coils, usually there's no real scientific reason why the coil would interfere with weight gain.
Okay.
Because, as we said, it doesn't have any hormones. Presuming she's talking about the copper one. Hormone contraception is variably associated with a bit of changes in weight, and the most implicated one is the one called estrogen. However, there appears to be a bit of change in weights with even what is contained in the injection.
Right.
And the coil I was talking about, which is called Mirena, which has the hormone called progesterone. There's reports of a bit of change in weight. However, what would say to people who really need long-term contraception and there's a bit of weight and they're not sure which is contributing to the other, they should look at their lifestyle, their diet and their physical activities, and maybe that's what they need to address, and then leave their contraception.
Okay, and I think it's now time for us to move to what options are there for men very quickly,
Yes.
because Justice is asking, can someone be allergic to condoms?
Well, it's possible, because condoms are made of something called latex, and sometimes there are people who have allergy to that, so that can happen. And if there was suspicion that's happening, then it would be important, to get that, cross-checked. And maybe if they're using condoms for contraception, look for ones that don't contain the compound they could be reacting to.
Okay.
Now, in terms of men, there's a bit of less choice for men as compared to women.
Right.
What is mostly applicable for men is the barrier methods, condoms.
Okay.
And, then these
How effective are they?
Well, they are as effective as, the discipline to use them. So if they're used consistently and, every time, and check there's no accidents with, either, getting torn or anything like that, then, they should be effective. And the other advantage is they prevent, sexual infections, chlamydia, gonorrhea, HIV. So there's an added advantage.
Okay.
So that's the main method for men. There's new studies about, pills that may become applicable for use by men. Yeah, not yet available in the market, but potentially in the future. and even injectables that may come up again in the future, and other, novel techniques trying to block the channels that, get the sperms out. So there are all these methods which are still undergoing, scientific testing, and leaves, the balance more towards women unfairly, than men. But who knows, in another few years, then there'll be more choice for men.
Okay, and apart from condoms, do we have another option for men?
Yeah, maybe, the last one is really vasectomy,
It's a permanent one?
Which is a permanent method. And, for men who have finished childbearing and they feel they don't really want to pursue more pregnancies with their partners, then they can have that as, their method, and that's it.
Maybe you can take us through how it works and maybe if it affects a man's sexual life.
Yeah. The straight answer is no, and it's very easy to do compared to, tying tubes in women. It's easier to do, and the effectiveness in terms of no conception in the future is actually much higher than tying the tubes. So if couples are out there and they feel they're done with pregnancies, then the man should consider as much as the woman, to get a vasectomy done. And
before you look at the questions, I was just looking at some of the questions, but one of our viewers is asking whether still on men, you talked about the condoms, use of condoms, and it's vasectomy.
Which is permanent.
Which is permanent. But they say still on the condoms for someone who doesn't want or who is allergic, like what Justus was asking. So they're asking with withdrawal whether it works.
Well, maybe, it can work, let's put it that way. However, the effectiveness of preventing pregnancy is very low compared now to, modern methods of contraception. So to say, because there's so much choice, especially on the women's side, there'll be some method out there that is suitable for them as a couple. So if, these problems with the condoms, I wouldn't really, using withdrawal method as the sole method of contraception. They should go and sit down with a healthcare provider and they look at all these other options. And then I'm sure they would find something that may be applicable on sort of medium to longer term basis. Yeah.
Dr. Alfred Murage is helping us with some of the methods for birth control that are available for both men and women. Talk to us. The SMS line is free of charge at 20268. The call line is 0791478990. And we are looking at some of your feedback right now. Keep them coming, keep calling. We are here for you, right, Dr. Murage? And let's have a look at what there's someone who's saying, talk more about P2 and their effects, please. Because it's really widely used. And do you feel it's misused? One thing, and for someone, the people who use it maybe on a daily basis, what are some of the repercussions for that? Is it recommended to use it as a birth control method on a daily basis?
Because it's an emergency contraceptive. It's trying to rescue a situation. So it should be looked at as such. So it is safe to use, and it's better to use the emergency contraceptive, commonly called P2, than to get an unwanted pregnancy. However, if anybody out there is using it day after day, every so often, that is an indicator that they need longer-term contraception. So the more often people find themselves buying P2 tablets, the more they should consider, why am I not on something longer term? And surely there's something out there that can suit them. In terms of safety, very safe. Used within 72 hours of unprotected intercourse. Beyond that, if somebody was beyond the 72 hours, it's
Can I
less
cut you short
effective.
once again?
Okay, yeah.
Someone wants to talk to us. She's called Mary. Mary, hi. I think we've lost her, but I'm sure she's going to call back.
Let me finish what I was saying.
Yes, Doctor.
If it's beyond 72 hours, it becomes less effective. But the ordinary copper coil can be used as an emergency contraceptive as well, and is effective even up to 5 days after unprotected intercourse. So if anybody's out there and they have missed that window of opportunity,
for 72 hours,
they can get the coil fitted in within 5 days. Now, in terms of people ask about the next period sometimes either gets delayed or comes too soon or looks a bit unusual. That can happen when the P2 has been used, so it should not cause a worry. So if the period that comes straight away is a bit unusual, the next period should be fine.
All right, and Esther is saying, please don't leave without giving me a response to this. She's asking, I'm so worried because I haven't received my periods. Is there any possibilities of that I'm pregnant?
The first thing to do if a period is missed and people are not on contraception, then they should do a pregnancy test. So she could be pregnant, and if she's not pregnant, then it's a bit of delay of her period, and then she should just wait for that to come back. Yeah.
Okay, and Mercy, lastly, as we wind up, I'm Mercy from Utawala. I have been using Depo, but my periods are coming non-stop. What might be the problem?
Okay, but that's a less common side effect of Depo. So what she should do is, again, get somebody to check her out, and see whether something else is contributing to this bleeding, and if it's purely blamed on the Depo, then there are ways to address that, and that would help out with her bleeding pattern. Yeah.
Okay, and someone else is asking, hi, I had a miscarriage 5 months ago. We are really sorry about that, and I haven't received again, I think, my periods. What could be the problem?
Well, 5 months ago, she said?
Yeah.
5 months backwards is quite a long time. If she's not on any hormonal methods that could be contributing to that, then it's worthwhile again getting checked out to see why there's a delay in return of the periods, because usually the periods would come somewhere between 4 to 6 weeks after the miscarriage.
Okay, and so Doc, you've said all these birth control methods that you've talked about, they are all safe, and in case someone, because many people have a problem with their periods, some are coming non-stop, others are not coming at all, they should not worry?
Safety is proven.
Okay.
Effectiveness is proven.
Okay.
And because there's a variety of choice, virtually everybody should get something that suits them.
Right.
And little worries about, is it going to cause harm? Is it going to contribute to other diseases? Or even infertility? Is not true.
Okay, and I think Helen is back as we wind up. Yes, she's back. Hello, Helen.
Hello.
Yes, hi, how are you?
I'm fine.
Okay, please go ahead with your question.
Okay, it was just a comment.
Okay.
First, I would like to thank the doctor because he has answered most of my questions.
All right, you're welcome.
Okay, secondly, I want...
Reduce the volume of your TV, Helen.
Hello?
Yeah, just reduce the volume of your TV, then go ahead.
I want to ask the doctor that they should be concerned about the patients they are receiving.
Okay.
That before giving out any contraceptive or any family planning, they should check the body, they should check it and everything, so that to make sure that there is no, hakutakuwa na shida yote baada ya kuweka hizo mbinu za kupanga uzazi. Because we are receiving a lot of women, baada ya kutumia mbinu ya uzazi, wanaanza kusema wana shida fulani ambayo imesababishwa na hiyo family planning.
Okay.
So my concern is that the doctor should test this patient, they should do guiding and counseling to avoid all these.
Okay.
Thank you.
Thank you, Helen. I think she's basically talking about making aware your patient or your client what this method, or educating them on each and every method before, or even especially the side effect for each and every method. Do you do that?
Yeah, we, that should be routine.
Okay.
And, I think it's upon us as healthcare providers to provide as much information as possible.
Okay.
So when people are choosing one method, they know as much as they could about it, and what may or may not happen, which may or may not be of significance. And, also when couples come, women and, their men, they should also try and ask as much questions as possible, so as they live with a lot of understanding about what they're going to use.
Okay.
And if they have any, things that they feel are not clarified, and they want that clarified, they could even, return. So a lot of, things that may be said against contraception, like, Dr. Mukaido said earlier, they don't have a scientific basis, and the issues about safety and contribution to other illnesses, is basically not really true.
And Doc, unfortunately, that's all the time we had for the show today.
Okay.
Yeah, Alfred Murage, thank you so much for your time, and thank you so much for enlightening us on some of the birth control methods that are available for both men and women. And thank you all for watching. So much of your feedback coming in, and we do promise to have a look at them and to respond to them offline. But for now, we will have to leave you. Remember, you can always talk to us. The hashtag is MyDoctor at Ebru TV Kenya. You can always keep those SMSs coming 20268, and also call us 0791478990. For now, I will have to leave you. Remember, you can always watch our previous episodes from our YouTube channel, Ebru TV. Always look for My Doctor. My name is Purity Musel. See you again next week on Monday, same place, same time.